because the ward is behind me, but actually just over the corridor here is where theatre happens. This is the operating theatre over here. And we're going to speak to Louise Gill, who is the matron for the ward. Morning, Louise.
Good morning.
Now, Louise's job, essentially, you are in charge of everything that goes on in the ward, and not just this one, but lots of different ones. So Julia is asking, you know, what's been going on this morning? You've had some people added to the surgery list today, haven't you, at the last minute? How's that been?
We have, yeah. It's been a busy morning. So overall, we've had 46 patients that have come through onto all of our elective surgical wards, which means that there will be 46 patients coming through to theatre. We have had a couple of late add-ons to that list, but we've been able to manage our patient load and staffing accordingly.
Yeah, you mentioned staff because part of your job is making sure that there are enough nurses on the ward to look after all of those patients, and you've already had, I think, 2 people call in sick today, is that right?
We have, unfortunately, yes. So we've had 2 staff members ringing sick for today. I've also had a staff member ringing sick for the night shift. It's my job as a matron, as a senior nurse, to make sure that we're safely staffed throughout all of the units. So I've had to look at staffing and look at acuity and make sure that we're safely staffed across all areas.
And have you managed to do that?
We have managed to do it. It is a daily battle, sorting staffing out. It's my job today, as well as matron of the day, to look at staffing not only for Chorley but also for Preston, which is what I'll be doing later on, to make sure that all areas are staffed.
Yeah, and people, we often talk about staffing when we're talking about the NHS, but what that means in reality is that people are coming in on days off, they're having to find extra childcare to cover those shifts that can't be worked because of sickness, because if they don't do that, the ward isn't safe.
Absolutely. So what you'll find is a lot of the NHS does run on goodwill. So we are, as you mentioned before, quite a tight unit. We are a work family, and because colleagues don't want to let other colleagues down, you find that staff come in on days off, staff will do extra. However, we need to be careful and cautious because we don't want staff to do extra, to become tired and then themselves go off sick. So it is a careful balancing act that we need to do.
Yeah, and behind us, I mean, obviously is the theatre, and you've already decided who will go first into the theatre this morning, and then after that, as you said, there'll be another 45 people straight after that person going through these doors. How do you manage that?
Absolutely, it is busy. We all work together as a team. I think that is absolutely key in making sure that patients go to theatre, come back and are safely discharged home. And
just explain to people what kind of theatres will be going on here today, what kind of operations?
So we've got a whole range of specialities. We've got plastic theatres running, we've got urology theatres running, we've got upper GI theatres, we've got a lot of orthopaedic theatres running. So yeah, there's quite a mix.
Got a lot on the go. And you mentioned there that you're a bit of a work family, but when I was talking to you earlier, Julia, what you were asking me was about how people feel working here. Obviously, COVID was very difficult. Absolutely. How does it feel now? Has it got easier? Has it got harder? What's it like?
So unfortunately, no, it's still difficult for staff in the NHS. Pre-COVID, it used to be that we would have peaks and we would have troughs where we'd find that we could recover a little bit. What we're finding now is that we are working at full capacity all the time, and it is difficult for staff.
And does that mean that you get more people going off sick or more people even leaving? I mean, how many people have you had leave since COVID? Has that been quite high?
So throughout my team, we have had a significant amount of staff leave post-COVID. I've had staff that have leave with post-traumatic stress disorder from the effects of looking after patients with COVID in critical care areas. I've had staff that leave nursing completely. And I've had some staff that have gone to the private sector because it is paid more.
Louise Gill, thank you for joining us this morning. So Sarah Cullen, we've been talking to some of the nurses here today about a little bit of staff sickness and how they sort that out. From your perspective, broadening things out, how is staffing at the minute? What are the pressures and how has that changed since COVID?
So nurse staffing shortages are a well-known national issue, and at Lancashire Teaching Hospitals we're no different really to other trusts across the country. We have taken a number of approaches to try to improve that situation for us. What's really important to us is investing in our local community, So creating pathways for widening participation for people who might not have had a traditional educational route into a profession is one way in which we're doing that. And we've seen lots of really great examples of people who might have left education, chosen to come back as a support worker and then trained as an assistant practitioner and then gone on to become a registered nurse. And we absolutely want to do as much of that as is possible and have got lots of options to be able to help people do that.
Have you found that since COVID you've seen more people leave the profession or join it, or is it kind of as you were before? Has it changed things, I suppose?
Yeah, it absolutely has. We've seen differences in all of our professions, most notably within our healthcare assistant group of staff and our registered nurses. We've seen the turnover of staff almost double during that time since COVID, and we think that that is likely due to rates of pay, working conditions and the pressures of society post-COVID.
So you mean people can, I guess, find better paid work elsewhere, so they leave the profession? They go and do other jobs?
Unfortunately, yes. A healthcare assistant rate of pay is not competitive compared to other more sociable means of work.
And what would they get paid? What would a healthcare assistant be paid, for example?
Somewhere between £11 and £14 an hour.